as well.
With Julia, it's not just that. You see, she has autism. She likes it when people know that.
Autism? Well, what's autism?
Well, for Julia, it means that she might not answer you right away.
Yeah, Julia doesn't say a lot.
That's right. And she may not do what you expect, like give you a high five.
Yeah, she does things just a little differently, in a Julia sort of way.
Oh.
Sesame Street always explains things so well, don't they? They change the dynamic for people living with autism when they introduce the character of Julia, who is autistic. So this has been in the news a lot lately, too, because comedian Amy Schumer recently made headlines when she revealed that her husband, a well-known chef named Chris Fisher, is also on the autism spectrum. New research coming out of ASU right here at home is actually helping to relieve gastrointestinal issues that are common for those who are living with autism. They recently discovered that transferring good bacteria from the stool of healthy people into the gut of someone with autism can actually help some of those GI problems and actually reduce the symptoms of autism by about 45%. Fascinating. We're talking about all of this because April is Autism Awareness Month. And this morning we are joined by Lana Graber, who is the director and CEO of Dynamite Therapy, and also Rachel Crawford, who is a mom who's joined us in the past here on Good Morning Arizona. She is a mom of 3. She has 1 autistic son. And ladies, thank you so much for being here to share your expertise, because it's really important for those of us who don't have somebody who's on the spectrum in our family or very close with us, that we have an awareness of what to be looking for, also how to respond and be supportive of families who are living sort of a different dynamic than maybe some of us. So Rachel, let me start with you. You joined us previously because you made a post about a very kind of nasty encounter you had out at the store, and that was showing someone's kind of ignorance about autism, right?
Sure. Just in general, it's, you know, he's a young kid. He's 3. Kids have tantrums. Kids have fits.
All 3-year-olds. Let's lay that out there.
An autism meltdown can be slightly different. It can be long-lasting. It's very ongoing. It can be, his emotions doesn't necessarily match what took place.
Okay.
So what he's upset about, it can be very big emotions.
Yeah.
And people don't understand that, and people don't know how to react to it. In those social settings, kindness is pretty much the best route,
Yeah.
Don't judge. I had another child with me, my youngest, and it was just a really stressful situation.
Yeah.
So,
may I ask you, when did you find out that he was autistic?
Well, I had my speculations when, just through certain milestones, he was not making eye contact. He wasn't saying mama and dada. He wouldn't, there was just a lot of interaction that wasn't taking place.
Okay.
And we reached out to the AZIP program, in which he was able to get speech and behavioral therapy, which helped tremendously because he was nonverbal. And he got his official diagnosis when he turned 3.
Okay. So Lana, you have a long career of expertise dealing with some of these issues, and you know how important it is for the early diagnosis. What are some of the signs that people should be looking for with their littlest ones, and how important is it to identify this early?
So that's one of the key points of why I'm here today, to talk about autism awareness, because early identification is so key to getting those early intervention services that Rachel was talking about. Just like she was saying, limited eye contact. He wouldn't be looking at you and communicating with you the way that I would be.
Okay.
Limited sounds, limited babbling. No pointing and gesturing, difficulty responding. He wouldn't respond to his name necessarily. And these are all different things that not every child is showing the same signs. They're varied. So if you suspect something, you want to call your pediatrician right away.
And if you're past that age of those like 3-year-olds, you're going to be probably showing the fact that you're somewhere on the spectrum in a different way. And I guess for the rest of us, it's hard to understand how broadly ranging this can be. I mean, some people, I'm sure, are on the spectrum, and most people wouldn't even know it.
Well, there's certain levels of genius as well, you know, from our autism awareness that that is shown.
Okay.
Some are tremendous with numbers and letters, but then there's also those difficulties where sometimes they'd rather be alone than interacting with others. Sometimes they have tremendous difficulty, like Rachel was saying, with environmental sounds or tastes or textures. Those are some of the signs to look out for when they're older.
And I guess it's important for programs, for people to just be understanding of maybe, I think adults love to correct children even when they're not their own children. And, you know, I'm talking to you, hello, and that would be overwhelming, right?
Honestly, I think this is such a good way to, like Rachel was saying, to address, let's be kind to everybody. Let's show love and kindness. Wouldn't Rachel have much rather received a smile from that woman? She could have passed that along to Bradley. Maybe it would have made a difference for everybody.
Definitely.
And for those of us with kids, what's a good way to talk to our kids about this so that they learn how to be friends with kids who are on the spectrum and be supportive and patient?
Me personally, I think just, you know, teaching your kid about compassion, you know, that not everyone is the same. And that's the beautiful thing about all of us. You know, we all bring something different to the table, and maybe just trying to find those things in somebody else, and just, spreading that kindness and understanding.
And just as we wrap up, Lana, resources are out there for families. It is not too late to ever get into some of these programs, right?
Right. Now, like we were talking about earlier, early identification is key to get into early intervention services. AZIP, Early Intervention Services, that's what it's called. You can refer your child yourself, or you can go through your pediatrician. That is for our birth to 3-year-old kiddos. Once they get past 3, there are other wonderful resources as well. Your local school district is available. DDD, which is the Division of Developmental Disabilities, and also community resources like Dynamite Therapy. We serve all children, and there's wonderful, wonderful therapy services out there. We would refer you to the appropriate place as well.
Thank you so much, both of you, for sharing today. And